Hello, this is Dr. Erica. Thank you for joining me on this particular video series, Eyes, Ears, Nose, and Throat, particularly allergic rhinitis. This is part 3 of the series. I'm going to talk about nasal steroids. Nasal steroids are medications for allergic rhinitis. They work topically. What they do is they decrease the immune system cells and cell mediators, decreasing inflammation around the nasal passages. And also, they work over time, not as fast as the nasal decongestants or the antihistamines, but they work over time to give a longer relief. Now, the peak time of relief is going to be about 2 to 3 weeks, and it takes about 1 to 2 days or a few days to actually feel some relief when using the nasal steroids. It's recommended while using the steroids initially, once activation of the spray, to not sneeze or cough, to make sure that the medication bioavailability is going to be effective, and making sure that the nasal passage beforehand is cleaned with a sodium saline irrigation system and also a nasal decongestant, so that the medication will be, again, bioavailable and working as effective as possible for the best effect. It's recommended that patients continue with the therapy, although the actual peak effect won't be seen for quite a while. It's recommended that patients do continue on with therapy and don't give up on the medication itself. Okay, so adverse effects will be sneezing, stinging, also headache could be a adverse effect as well. Do avoid this medication class in patients who have had a nasal surgery or nasal trauma, also patients who have a nasal septum or nasal procedure that has recently occurred. Okay, now this medication may cause some mild vasoconstrictions like the nasal decongestants, but it's very mild. So therefore, a nasal decongestant can be used with this particular medication for fast relief. But again, it's only for an initial response. Okay, now this particular medication is very effective, and the side effects are very much reduced just because it's more topical than systemic. We know that steroids long-term use is not very good. It causes different side effects, major side effects that are very known with the class of steroids. And I'll give some examples of some of the side effects that systemic steroids cause. Not so much the topical nasal steroid, because it's not systemically absorbed through the nasal passages. Okay, so growth suppression, which remains a question, with some evidence showing that the nasal steroids with higher bioavailability may have a great growth suppression effect. Okay, also hypothalamic pituitary axis suppression, cataract formation, glaucoma, and bone mineral density changes in doses used for allergic rhinitis. Okay, so those are some of the concerns that are out there, have been broadcast. However, it is safe to continue with nasal steroids because they are topical and the benefit outweighs the risk. Okay, so do be aware of that. Also, systemic effects can be edema. Also, it could be weight gain, which is very much popularly known. Some of the examples of nasal steroids that are out there on the market is Nasacort, triamcinolone, mometasone, as well as prescription medications. There's also budesonide that's on the market, and beclomethasone as well. Um, and also the Flonase. Flonase or fluticasone is also available as a nasal steroid. and can be purchased over the counter. They are a little bit more expensive as far as discounted pricing, OTC pricing. They're a little bit more expensive than your antihistamine classes and your pseudoephedrine and your phenylephrine nasal decongestants. Also, your topical decongestants, your oxymetazoline. This particular class of steroids are going to be a little bit more expensive just because of their efficacy and also the content of the particular medication. So do be aware of that. Now, nasal steroids, they are purchased more readily, especially during seasonal changes, this spring season. You don't see them purchased so much during the flu or influenza season, but more so during the allergy season. Um, and also, patients who are taking antihistamines or pseudoephedrine can also take this particular class of medications as well, but typically it's only taken with the antihistamine and then the steroid as well. So this part 3 of the eyes, ears, nose, allergic rhinitis is pretty much all of the medications that I've mentioned, part 1, 2, and 3. So do be aware of the classes that are available. And also the dosing for the steroids. The dosing is going to be for ages 12 and up and adults, and then ages 6 to 12. Ages 6 to 12 pediatric patients can also utilize this particular class of medications. Okay, the dosing is usually going to be sprays inside the nostril, 1 to 2 sprays twice daily to start. And then the actual change in dosing can be once daily for a few days. Once the patient has become tolerable and become more familiar with the medication, then the dosing can be decreased over a period of time, because it takes about 2 weeks for the full effect to be reached and experienced, and then the medication can be dosed down. Okay, so that is a plus with this particular class of medications, given all of the adverse effects that can be seen. Okay, so that is the nasal steroids. Again, it's over the counter, and then stronger strength are also prescription. Do be on the lookout for new classes of medications to help treat allergic rhinitis that are being researched currently and are being presented in the media as well. So with that being said, I'm signing off. I am Dr. Erica. Please leave comments and topic suggestions. Thank you. Like, share, and subscribe. Bye-bye.